we saw that there were certain pillars. EHR for us was a pillar. Same thing with ERP. These are systems that are really hard to change, or they're expensive to change, and they're not things that you change every 2, 3, 4 years. They have usually a 10 to 15-year cycle. If you have got a good product, if you've got a good company backing it, and you've got a good team continuing to support and implement it. We also thought the way we have developed our governance, which helps us to ensure that we are able to make decisions quickly, we are able to get different perspectives on the decisions that we are making, and engage our business and operations as well as our clinicians, was a huge pillar for us. And then everything else that we did from a digital perspective was in between. Things that these things couldn't solve, we were looking at products. So think about a web of products on the digital space that is then connected to these pillars that are kind of immutable for us. One of the other ways we looked at projects that we were working on is, what stage is this project on? Is it in the ideation stage? We're just talking about it, talking to different vendors and software developers about it, talking to some of the pillars about it to understand what is possible, and trying to get best practices not only from healthcare, but from other industries. So for example, chatbots, we talked a lot to folks in other industries, especially in banking, because they had done chatbots before. So we had a lot of conversations with Capital One. We had a lot of conversations with eBay in terms of how they were thinking about it, so that we could take some of those best practices into healthcare. Once we had completed the ideation, we had a sense of what the product is. We had a sense of what the market looks like. We started getting into proof of concepts. We'd pick up anywhere from 1 to 2 docs to 1 to 2 practices to actually test it out and learn in real life what this would look like and how it would feel. After that, it was scaling up stage to say, can we do this across the board? And scaling up has its own challenges. Can the product withstand it? Can we as an organization scale things up? And finally, getting into steady state, which is you're just looking at feature enhancements, upgrades, etc. It's less cumbersome, and there's a support team handling it, not a project team. And then some of these things transitioned over time too as we matured. And then, COVID hit. And it was all hands on deck. It was an interesting period for us in terms of the impact and the implications it had to our lives. And the early days were pretty scary. We actually did not quite understand what this virus does, how it propagates, and what the implications could be. And if you think about us, we take care of the sickest kids in the Bay Area. And that meant we had to be extra cautious. A lot of them are immune compromised. Which meant that any risk could jeopardize their chances of survival. Now, luckily for us, we have a really good program for infection prevention and control, and they went into full mode in terms of ensuring that the best practices that they use could be adopted throughout the hospital very, very rapidly. Now, this is one of my favorite quotes, with every crisis is an opportunity, and we shouldn't waste that. And we definitely took advantage of this particular one. Despite it being a pretty painful time, it was also an incredible time to innovate in healthcare. In fact, we think that we did in 6 months what historically we would have done in 6 years. And part of the reason for that was, one, there was no playbook for COVID. So a lot of things were done on the fly as we were learning more about it. And as we learned more, our approach to doing things changed. In fact, we created new rules for engagement. We had to be very creative. We had to do rapid test cycles. We were okay with failing fast and moving on. And this is unheard of in healthcare. Healthcare is extremely conservative as a business. So, when you talk about measuring twice and cutting once, we measure 10 times and cut once. Even waterfall approach for project management fails miserably, which is what we use heavily. And sprints weren't fast enough when you were dealing with COVID and dealing with new information coming in. So we were making decisions on the fly, and timelines were deeply compressed during this period of time. But on the flip side, if you looked at our adoption, we standardized a whole bunch of things very, very quickly. We did not customize it. And then really there wasn't another choice, both from a provider and a patient perspective. So the whole concept of let's give a lot of choices kind of went away. And the idea of giving one really good solution was what we were driving towards. Finally, there was tremendous executive engagement. We had to rethink our business models and support models, and you have to survive before you can thrive. So it made a lot of sense for us to kind of work together.